Good morning. My name is Joe Doherty, the Communications Director for the Utah Department of Public Safety and Unified Command. Today's our regular briefing for Thursday, August 13th, 2020. Today our speakers will include Governor Gary Herbert and Nate Checketts, who is our Testing Director under the Unified Command operation and with the Utah Department of Health. And we'll also have Dr. Mark Briesacher from Intermountain Healthcare. So we'll turn the time over to Governor Herbert.
Well, thank you, Joe. Again, as always, it's a pleasure to be with you this week, and we appreciate those who are tuned in and listening, particularly those from the media, and we'll have an opportunity as we go through the presentation to give you a chance to ask questions to us today also, so we'll look forward to that. Let me, as I begin, just reflect upon the fact we've come a long way through this pandemic. It's been a challenging time for all of us. It's certainly been uncertain. We've learned a lot as we've gone down this road, and we still have, I think, a lot yet to learn. And we're using some of the best minds in science and medicine to help guide and direct us as we develop policy. Today we start a new chapter, kind of a new chapter in our history, as we now are going to open up schools, our public school system, go back to school during the middle of a pandemic. That hasn't happened since 1917. So it's a new experience for most of us here in a little different situation. The Washington County School District is opening up today, and we know that across the state, as we open up our school system and our 41 different school districts, it won't be quite the same as how we've done it in the past. It'll look different. It's going to feel a little bit different. And so I'm asking everybody, all of us, to be a little more patient. Understand that there's going to be some differences, that we're going to need to make some adjustments as we go through this challenge. And again, we'll have some nuances and I'm sure modifications as we go through the school year. People ask me a lot of times here in the last week or two, why? Why are we opening up our schools? And people want to have school. Our students want to go back to school. Our parents want them to go back to school. Our teachers want to be in school teaching. We understand the significant importance of our public school system and the ability for our people to go there and learn, and develop skills, become productive members of society. It's the building block upon which we, in fact, function. So we want to have that. It's also, as we look at people or organizations, for example, the American Academy of the American Academy of Pediatrics, our pediatrician organization, strongly advocate that all policy considerations for the coming school year should start with the goal of having students physically present in school. We also have the National Academy of Science, Engineering, and Medicine, who's echoing that same sentiment that we would want our kids to get back in school, in a physical building. And so we're trying to recognize that's an important aspect of society and of the well-being of our young people. So that's why we're doing it. Again, I hope people understand there's been a lot of work put into getting to where we're at today. Our state school board, elected by the people, our local school boards, 41 different districts elected by the people, our state health department, which has got the best science and medicine available here in the state to help guide us. They've created standards by which the districts need to, in fact, function. They have a manual of standards that have to be met. And then, of course, the local school districts are putting together their own plan, and with some flexibility as they have unique circumstances throughout the regions of the state of Utah. So I don't know that all the plans are going to be the same. There's going to be differences between the 41 different districts and even in some of the schools inside the districts. But flexibility is kind of a key to making this work. And I appreciate the work of so many in bringing this together. Now, I mentioned some standards. One of the requirements we said is statewide. We want everybody that's involved in the education system inside the school building, on the buses, to wear a face mask, face coverings to help protect the spread of the coronavirus, which in fact is spread by droplets and that come from our mouth and nose. And so we've asked that to be done as a mandate throughout the state. I want to make sure that we have some clarification, because at least we had this raised here yesterday, the clarification about the public health order for the mask requirement. The order allows for clear face shields for extra, and I emphasize extra protection if desired. But face shields should always be worn with a cloth mask to control the spread of respiratory drops. Face shields may be worn without a mask in some very specific cases, dealing with those who have disabilities, deaf and hard of hearing, where students have a problem with speech, maybe need to read lips. And so there are exceptions to that, but most of the time is wear a face mask and you can have a shield, but a shield alone is not preferable. Last week we delivered KN95 masks to all of our teachers, all the school districts, so the teachers could have more mask options as they go forward. So as I see what's taking place and the collaboration, the cooperation from many, that get us to the point where we can open up our school system, I'm very encouraged. I'm cautiously optimistic that we are in a good place to start this. I think we do it in a safe way for our students and for our teachers, minimize the risk to our students and to our teachers with what we've put in place. I also like the trends that we see that are taking place. The case numbers are falling and our transmission rates are going down. So I think we're in a good place. But I would emphasize it's no time for us to be complacent. If anything, we probably need to increase our efforts of doing the things we've been doing, the wearing the face mask, proper hygiene, hand washing, social distancing, all those things which have helped us to get to a good place need to continue with maybe even more emphasis. I like people, again, I know it's, for a lot of us, it's a habit that we've not got used to of having a mask, a face covering with us. If you're going to leave your house and grab your keys, grab your mask, grab your purse, grab your wallet, grab your mask. Hang it over your rearview mirror. Again, it shows a concern for your neighbors, that you have respect for them, and you're going to do your part to make sure that wherever you interact with people is a safe environment. Last but not least on that area, I know there's room for criticism. Again, certainly the state's made its mistakes along the way as we've learned as we go and had to change courses here and there. But I would hope that people, rather than criticize, let's get to the mode of encouragement, encouraging people because of our love and concern for our fellow man. And let's encourage each other to do good things because it's the right thing to do. And not because government's compelling us, but because it is in fact the right thing to do to help us slow this pandemic down. It's based on good science, it's based on good medicine, and allows us to be good neighbors and good citizens. With that, let me just excuse Dr. Dunn. She's away on a much needed and deserved vacation. She's spent the last over 6 straight months working, very diligently in trying to help us navigate this pandemic, and so she deserves a little time off. And so let me just give the report, if I could, in her behalf. Today, we will report 45,424 positive cases, which is an increase of 334 cases from yesterday. We'll report 584,656 people that have been tested. That's an increase of 3,447 people tested from yesterday. The rolling 7-day average for positive tests is 354 per day. The rolling 7-day average for positivity of our laboratory tests is 8.6%. Hospitalizations, there are 184 people currently hospitalized with COVID-19. And total deaths are now 353 deaths, which is an increase of 2 deaths since yesterday. As I mentioned earlier, the trends are going in the right direction. I'm grateful for that, grateful for the work of so many here in the state of Utah doing their part. Again, we need to continue that effort so we can, in fact, get on top of this pandemic. With that, we have an opportunity today to talk about testing. There seems to be a lot of confusion and certainly a lot of questions about testing. And so we've brought in one of our experts here, Nate Checketts, who's the testing branch director for the state's COVID-19 response. to help us understand the importance of testing, what it means, how it happens, and what's going on, and some of the questions we have. And I think that's an opportunity for us to understand better. So let's invite Nate Checketts to come in, and then I'll ask some questions, and you can respond. So come on in, Nate. Okay, Nathan, it allows us to happen a little better. I've got a mic here, so I don't have to come and use your mic. But let me just ask the questions here first. I will have 6 or 7 or 8 of these questions. Why is testing so critical in our pandemic response? What is the purpose and the need, and why is it so important?
Yeah, thank you. So testing for COVID-19 is a little different than some of the other testing that we do for other diseases. If you think about something like strep throat, if you get tested for that and found out are positive, then there's an action that we can take that you and your medical professional, your doctor, can go through to address that and treat the disease. Unfortunately, with COVID-19 being a viral disease and the state of our medicine today, we don't have direct treatments for that type of condition once you're identified. So why do we test? What's the importance of that testing? First of all, for an individual, it's important to know whether or not they're positive with COVID-19 or some other disease, whether that's flu or something else. It's also important for those that you are your close contacts. So if you're identified positive as for COVID-19 and you've had interactions with other individuals, they need to know too, so that they can also begin the quarantine process so that the disease doesn't spread. And finally, as a state and as a nation and as a world, we need to know the extent of the spread of this disease. And so by having those positive results and having those test results, we know how far the disease is spreading, where it's spreading, what communities it's spreading to. And so it helps inform the state's response. And as you've seen, as we've gone through the pandemic response, there's been periods where there's been stay-at-home orders, there's been mask orders, there's been a variety of things that are part of our response based on that information. So the test results help inform our response, family's response, community's response, and the state's response.
Very good. Thank you, Nate. This is 3 questions that we hear all the time, so I'll combine them together. But how many tests can the state handle? What is our capacity? That seems to be a little bit unclear. It's varied and certainly has grown. But how many tests can the state handle in a typical day? Who should be tested? And do you have to have symptoms in order to get tested?
Yeah, thank you. Yeah, we've had an incredible journey here in the state and in the country in our testing capacity. If you go back and look at March, we were able to test hundreds of individuals. At the end of the March, we were up to 800 individuals that we could test in a single day. And that was maxing out the capacity of all the players that were involved, the state lab, ARUP, Intermountain, and that's all we could do. And at that time, the type of extraction we were doing were actually requiring manual effort. There were manual kits, and we were trying to find manual kits. And if you remember back from those days, we were putting out releases saying, hey, we need more extraction materials. We can't find extraction materials, working through that process. We've come a long ways from there. We are now up to a capacity of around 9,000 a day that those labs and other partners can do. We are moving it. We are well into automated extraction and automated processing that allow us to get to those types of numbers and be able to do that on a daily basis. And we continue to add to that on a regular basis too. All of the labs are working on improving their processes and working through ways that they can add additional capacity, whether that's buying additional machines that allow them to process things faster or additional numbers, whether that's bringing on additional staff. And that's been one of the pressure points we faced as we've sought to increase the state's testing capacity, is to try to find qualified individuals that can come in and help us operate these machines in the labs. And also looking for new ways, new ways of completing our testing. So who should be getting tested right now? For many months now, we've had out as our statewide guidelines that individuals that are symptomatic should get tested. There's 6 symptoms that are up on our state website. Hopefully everyone is familiar with those. We talk about having a fever, a cough, a sore throat, shortness of breath, muscle aches or pains, or a decreased sense of smell or taste. If you have any of those 6 symptoms, you should go get tested. Our systems, our healthcare systems, our referral systems, our healthcare providers are set up to help you if you have one of those 6 symptoms, get tested. There's also some other individuals that maybe don't have those symptoms that we would also want to encourage to get tested. And that's if individuals are a close contact of someone who has been positive. That puts you in a high-risk situation, and you may be the next person to get COVID-19 because of that exposure. So individuals that have been within 6 feet for more than 15 minutes of a positive individual are identified as a close contact. We work, as the test results come in, those are passed on out to our public health staff around the state, and they actually go out and try to help you identify any of your close contacts so those individuals can be identified and notified that they are at risk of COVID-19 because of that time that they spent as a close contact with you as that positive individual.
Very good. There's a number of different tests we hear about out there. Can you explain the difference? Are there all the tests the same, or what are the differences between the different variety of tests out there available?
Definitely. Yeah, I'll talk a little bit about the 3 primary types of tests that we have available right now, and also a little bit about how we collect those samples, because they're a little bit different for some of those different tests. The first one is commonly known as the PCR test, the polymerase chain reaction test. And that's the one that we think of mostly. When you think of someone saying, I went and got a COVID test, it probably was this type of test. And you've seen the pictures. Most of these are done through a nasal swab that goes up through your nose, back to the back of your throat in many cases to get that sample. That sample is then taken and sent to a lab where they can do high throughput testing with a high complexity test that's very accurate. But it needs to be run in one of those high complexity labs. And these tests are the ones that we believe are the most accurate in the system and telling us how to get those results. And so when we talk about capacity right now, that's generally referring to our PCR capacity. How many tests do we have access to? How many can the state labs run? And that's when we're talking about the 9,000 or so a day. In addition, there's another type of test that can also diagnose current infection it's called an antigen test. It actually goes through and looks for proteins on the virus, and if it identifies those, can help identify whether or not you are a positive individual or not. One of the advantages for these antigen tests is that the current products that are coming out are rapid tests. And so the turnaround time on some of those antigen tests are actually in the 15 minutes or so. Now, some of these tests that are coming out, they are good at telling us whether or not an individual is positive. So if you are infected right now, it will help you know whether you're infected. Where they're not quite as accurate as the PCR tests is that sometimes if you're positive, they're missing that. They're not always telling us every time that someone is positive. And so your healthcare provider may work with you. If you take an antigen test, if you receive an antigen test and it is negative, your healthcare provider may look at your situation and say, you know what, there's a lot of other things telling us that you may be still COVID positive. We're going to follow that up with a PCR test to get confirmation whether or not you are positive or negative. The last group I'd like to talk about is the antibody test. So there's a very different purpose. It lets us know not whether you're currently infected, but whether you have been exposed to the COVID-19 virus and what your body has done in response, whether it's produced those antibodies. One of the things that is difficult for us to know how to use going forward is that with the antibody test right now, and if you are positive, we don't know how long that immunity that would come from those antibodies is going to last. And so it is helpful to know that type of information, and especially on a statewide basis to look at those antibody tests and know what communities have been exposed over time, what population groups have been exposed over time. and really to what extent the infection has penetrated into our communities. We may only be finding some individuals through the PCR testing that we may find out later through the antibody testing that actually the exposure was broader than what we saw through the PCR testing. Some early results that are coming back from some of the systematic antibody testing we're doing indicate that maybe there's 3 individuals for every one that's been identified through the PCR testing that has been exposed at some point along the way and is positive for antibodies. Lastly, I'd just like to talk real briefly about the collection methodology. So for most of these tests, as I mentioned at the beginning, we're familiar with the swabs. They go to different parts of the nose depending on the swab that's being used with your medical provider. Some of them go all the way back to your throat, some would go part way up your nose, and some are able just to go to the front part of your nose. Or there's also one that goes through your throat. Those have all been approved by the FDA, but there are also other methodologies that are on the horizon, some of them approved with some tests, but not yet with all of them, to look at saliva as a way of collecting that. And then as we talked about the serology test or the antibody test, those are done through blood draws. So there's different ways of collecting those samples for those tests.
I hope they're taking copious notes at home here.
Okay.
Now, if we need to get a test, we decide, you talked about who should get tested. How does a person go about getting tested? Where do you go to get tested? Do you have to make an appointment? And how long does it take to get your results back?
Yeah. So the best way to get tested is to contact your healthcare provider to see if you need to get tested. And we also have available on the state website, if you go to coronavirus.utah.gov, right at the top of our banner, there's instructions on where you can go to get tested. We have a map on our website that lists 74 different sites that are open to the public, and you can actually click on each one of those individual dots that are on the map. It'll bring up the location, the time that it's opened, and any specific instructions that may be related to that specific site. Most of our partners encourage that you go to their referral system first before you come to their site. So you go on to Intermountain site or the university site or the Test Utah site to go through the process, answer the questions, make sure that you're qualified for a test, and then actually get your referral that you can take in. And that speeds up your process once you actually get to the testing center. Some sites do allow you to drive up, walk up. So if you look on our testing webpage, that additional information is available on there on how you can sign up for a test. Related for payments for the test, the way that the Families First Act set this up is that individuals that should not be paying for tests that are covered by their insurance. So insurance is set up according to the Act to cover when a test is medically necessary. So if you are symptomatic, if you are a close contact, if you have a healthcare provider referral, if you have a local public health referral, those tests should be covered by your insurance and you should not be charged for those. If you don't have insurance, you can go to medicaid.utah.gov, and there's a special program that's been set up just for COVID-19 where you can sign up and register and your tests will be covered through that program. And if you don't qualify, if you need additional assistance, you can also go to our hotline, which is on our webpage, or to the chat feature on the webpage to be able to get additional direction on how to find testing that's available for you and could be covered at no cost.
So it sounds like what you're saying, Nate, is that for most people, the vast majority, there is no cost to get a test. All right?
That's correct.
How long does it take to get the results back?
Yeah, so as we look at our turnaround times from when an individual gets a sample collection until the results are posted to their provider, we've been looking at 1 to 3 days, or have been our average over the last couple weeks. We know when we had the surge back in June and through mid-July, with all of that testing volume coming in at once, multiple parts of our system had backlogs as they were trying to process that many tests that quickly. And some of those times were delayed. But now as the testing volume has gone down, the labs are reporting that they're able to move back to their lower testing times. The state lab, as an example, has been able to move its turnaround times back down to around a day, sometimes just a little over a day, but right in that range as its volumes are now more aligned with what its testing capacity is.
Along with this testing, you say we have the capacity to do nearly 9,000 tests per day. And yet the numbers we just saw today is significantly lower than what our capacity is. And people wonder, why are the numbers going down on those who are getting tested? What's your explanation for that?
Yeah, we've taken a look at that several different times over the last couple of weeks because we are interested in knowing those results too. And our best information seems to be that there is less prevalence of the disease in the state, and there's been less demand based on that. As we talk to our sample collection partners, so the University of Utah and Intermountain, and those others that are operating the sites on the front line, they're reporting the same thing and have been over the last couple of weeks, where they've been reporting 20-30% reductions in the number of people coming into their sites. That would be a great development, and we're hoping that that's what the data is showing us, is that the infection rates actually have gone down, and that's why fewer people are coming in to get tested.
Last question, and that has to do, if you're tested positive, what do you do? If you're tested negative, what do you do? You're out of the woods? So answer those two questions and we'll call
Sure. So with a positive test, you need to isolate and be in your home, wear a mask when you're around others, even in your house. You're obviously infectious, and we want you to try to avoid spreading that to others in your household. And you'll need to go through that 14-day isolation period and make sure that your fever's been over for more than 24 hours, and it's 10 days longer from when your first symptom was identified. If you're negative, the way our tests work is really just telling you that in that moment when you were tested, you didn't have the virus, that it wasn't at significant levels. Unfortunately, that's not a sort of a get out of jail free card that you'll never be infected, or that even if you are tested too early in an exposure, that you may not become infected later, or that it will present itself later. So we do, if you've been a close contact exposure, we do recommend that you continue your 14-day quarantine because sometimes if you're tested early in the process, it's possible individuals develop the disease differently, that up to 14 days you may develop it later. So it's important that you complete that quarantine if you've been a close contact exposure so that you don't have potentially spread it to others after that period.
Okay. Maybe one last sum up, Nate, and that is, what's the future of testing? Is this something we're going to have to live with forever? We're going to have this constant, have to go in and get tested as we have symptoms for ad infinitum?
Yeah. Unfortunately, my crystal ball, like many others, is probably broke about what exactly our future holds. The way I look at this is that we have made tremendous efforts to get where we are today. And there are many things that are on the horizon for us that we should continue pursuing forward. We hope that a vaccine will be there soon, and that will change some of the dynamic. But until that point, we're moving forward. For example, at the state lab, we're adding additional personnel. We're bringing in additional machinery. Our projections are that we can triple capacity at the state lab coming for this fall. We are looking, with your direction, to partnering with other states to go out and purchase more of these rapid tests, these Anagen tests, to see if we can convince manufacturers to produce these in greater numbers and be able to have those available in the state. It would be a tremendous change in our process if individuals could go in when they're symptomatic and have a 15-minute test and have the results, and then start off that process so much quicker rather than waiting for a day or 3 days. So there's a lot of good things on the horizon. We've been working hard. We're going to keep working hard. Definitely appreciate the partnership we've had with the healthcare systems and the state employees that have been working on this. Amazing effort put in to try to make sure that we're staying on top of this.
Well, thank you, Nate.
Thank you, Governor.
Appreciate your good work and keep it up. Let's switch gears just a little bit now, if we could. I had the opportunity here just a couple of weeks ago to go visit one of our great hospitals in the ICU unit and see the ICU staff. And clearly, we all know this, that our heroes today, those on the front lines of this pandemic, are medical professionals really doing what they can to make sure that we preserve life and help us get through this pandemic and the impact it has in every aspect of our society. So we certainly want to express our gratitude for them and to everyone that's involved in this fight. I learned recently in my visit that we have people who are saying, want to take it off? No, I'll just take it off in a minute. Is it okay? You're getting done? Okay. Hold on a minute, I'll be back. It's okay. Okay, sorry. I guess we're getting double feedback there. So again, an opportunity for us to learn from those health professionals. When I was in the ICU unit, we're finding out that people are, in fact, are delaying getting health care that they need to have, whether it's elective surgery or treatments at the hospital, because they're afraid to go there, because that's where COVID-19 patients are housed. And somehow they feel like that's maybe not a safe environment. And so in order to maybe help us answer some of those questions, we've asked Dr. Mark Briesacher, who is the Intermountain Healthcare's Chief Physician Executive, to talk about hospital capacity, what we're doing in the intensive care units, how that is being impacted by COVID-19, and the opportunities that we have for those who need health care at the hospital, whether they should be afraid, concerned, or whether they should take advantage of the opportunity to go in now. So Dr. Briesacher, if you'll come forward.
Governor Herbert, thank you for your leadership during this pandemic, and thank you. We're grateful for the opportunity to be here today and to talk about this. And so let's just get right to it. So first, it's important to know that our hospitals and clinics are safe, and they are ready for any healthcare need that you have. Through the leadership of the Utah Hospital Association and the collaboration with my colleagues with hospitals across this state, I know that's true of their hospitals as well. We have in place processes that are designed to keep you and your family safe and designed to keep our caregivers safe. So when you present to our clinics or you present to our emergency department, we screen you, and if there is the potential that you have COVID-19, you're moved into a specific area. If you're presenting for other things, like you're having heart symptoms or stroke symptoms or other emergencies, then you're moved to a different area and cared for in that area. All of our caregivers take all the precautions you see across the state. We wear masks, shields, we gown up, we have specific devices that purify the air and helps keep them safe, and it helps keep you, your families, patients safe as well. Additionally, as medical services have increased across the state, we continue to take important precautions. So extra cleaning, extra testing before procedures to make sure that you don't have COVID-19. We have had to restrict visitors for some of the time, and that's part of it as well, is to keep patients safe and caregivers safe. And we'll continue to do those things. I think the second key message here is that it's really important that you don't delay care. It's important for your health. It's important for our community's health. And delays in care can actually be life-threatening. If you're due for a skin cancer screening, breast cancer screening, colon cancer screening, please go and get that done. If you have diabetes, if you have heart disease, if you have any other type of medical condition, please check in with your provider and make sure that the plan you have is the right one today. Make sure that the medications you're taking are doing the right things for you and that you're not having any side effects from them. We've seen a decrease in the number of people who present to our hospitals with emergent and life-threatening conditions, and this actually is true across the country. The national study found that there's been a 40% reduction in the number of patients presenting to have stroke symptoms assessed and treated. There's been a 35% reduction in the number of patients presenting with symptoms of heart attack. And in these conditions, every minute counts. So please, our hospitals are safe. We're ready to care for you. Don't delay care for these life-threatening conditions. There have been many great stories about healthcare workers and teams during the pandemic. And there's also been some sad stories, a lot of sad stories. And some of them have been related to the delay in care that people chose to do because they were worried. And those are the stories that we can avoid. So please come and see us if you have concerns. The last thing that I want to share is I just want to join Governor Herbert and double down on our continued need to mask, to remain socially distanced, to wash hands together. Our efforts together as a community, it's making a difference. The 7-day average number, it's just great to see that number coming down. And that's leadership from the state, and it's your individual actions and decisions, the care you're showing for your neighbors and friends in the community, that's making the difference here. You know, community health is what we need to have so that our communities can grow, can continue to care for each other, can be hardworking, industrious. So let's stick together and let's keep focusing on masking, hand washing, and social distancing. So 3 things. It is safe to get care in our clinics and hospitals. Please do not delay care that you need. It makes a difference in your health and well-being. And please keep masking, hand washing, and social distancing. Governor, that's all I have. Thank you.
Thank you, Dr. Mark Briesacher. Again, an example of our best and brightest out there in the front lines. As you all know, when we started this, we said we cannot overwhelm our healthcare system. And thanks to the leadership of many in our healthcare profession, we've been able to, in fact, treat people and help them get back on their feet and have minimal inconvenience and still have capacity at hospitals. So, again, we appreciate Dr. Mark's efforts here today to tell us to get back, and if we have issues, the hospital is a good place to go to take care of treatment and surgery. With that, let me just, again, sum up, and then we'll turn over to questions. I'll just sum up by saying this. Life is really about choices. We have challenges that come along. This is certainly one that's been unforeseen, but there's many challenges in life where we have to make a choice and make decisions. This has to do with our health, and so let's make sure we take and make healthy choices. That includes not only our nutrition, how we eat, our diet, our exercise, you know, doing the common sense things that Dr. Mark just got through telling us to do. We've been talking about for the last 5 months, social distancing, wearing a mask when you can't do that, taking extra precautions, being careful, hand hygiene, those kind of things, staying home when you're sick, not pushing the envelope today, it's too risky. Those things are going to help us. It's really a matter of us working together, keeping ourselves healthy, and also doing our part to keep those around us healthy also. So thanks for all that you're doing. We'll now turn it open to some questions. Any questions that we have out there?
Yes. Hi, can you hear me okay?
We can.
Okay, good. I think that this is probably a question for Nate, but looking at the number of tests, I know you said that demand for testing has gone down, but we see the number of tests and the number of new cases declining over the past couple of weeks much more sharply than they even increased. Does that seem right to you? I mean, is there an explanation for testing demand going down even faster than it rose when we were peaking?
So as we look over the last couple of weeks and looking into the surge itself in June and July, we really looked with our testing partners to see why it surged so quickly and to so many tests. And as they kept reporting back to us, it really was the number of symptomatic individuals that were showing up at their sites. And as we have done a similar discussion with them on this downward trend, they are reporting the same thing, but in the opposite direction, saying there are just fewer symptomatic individuals showing up to be tested at their sites. And that's what they're reporting back to us. We do caution as you look at the daily numbers as what's coming in, that there is always that flow with the labs about whether every test has been made it all the way through our system. And you can see on our charts that we post that we encourage you to wait a few days before the numbers are finalized, before looking at those. So again, urge cautions on looking at the last couple days numbers until all of those lab tests have come in. But that overall, we're seeing that it's a lower demand from symptomatic individuals.
Yes. Hi, this is for the governor. It's Lisa Roche. Governor, there's apparently a special session planned for next week. Is it one that you're calling? And if not, why not? And what do you see the need for lawmakers to deal with next week on COVID as well as other issues, including budget issues? Thank you.
That's yet to be determined entirely. I've had some preliminary discussions with the legislative leadership. I think there are issues that they would like to address that they want to call themselves into session regarding. There's issues that I would probably concur and say, yeah, I'm happy to call them into session too. So maybe it'll be a mutually acceptable situation where we both call it into session. That's yet to be determined. So we need to make that decision by probably Tuesday of next week, how that's going to be played out. But the issues at hand really have to do with something that's timely, something that has to do with the pandemic, those kinds of issues that we cannot delay till a general session. So that's yet to be determined.
Yes, I have a question for the governor. You're looking positively towards the start of the school year, but as was widely reported on yesterday, 3 football players at Bingham High School tested positive for coronavirus, and the state recommends in their manual that if 15 students get sick, the school should close for 2 weeks and do virtual learning. Did these most recent positive tests on a team raise any concerns for you heading into the start of the school year?
It causes us concern on a state level. Activities, sports activities are handled by the Utah State High School Activities Association. They're the body that determines the rules and regulations by which we participate in these kind of activities and sports. We're going to meet with them, our health department, to discuss some of the concerns we have to make sure that the health department feels good about their protocols and what they're doing. Again, I know we love our sports, and I'm certainly one of those that's a big fan, but we want to make sure we do it in such a way that it's safe. And it's an attempt to try, and there are certain parameters that need to be followed. And if we have infections that happen with a team, that team is going to have to be quarantined. Just like in school, if we have 3 in a class that get infection, that class will have to be quarantined too. So similar kind of regulations for our sports activities too. We'll see what the discussion happens here today and tomorrow with the Activities Association or Health Department.
Yes, Gustavo Jaimes here. My question is for the governor. Governor, today some students return to class under specific rules to keep them safe. And having in mind that over 7% of the cases in Utah are children, what if these plans don't work? I mean, we're having a hard time making adults to understand the importance of being safe, wearing masks, practicing social distancing. What makes us think that children are going to follow those rules, even if maybe in their own families they don't see that behavior, and we just end up with an increase of the cases in children and all of them bringing the virus to their own homes.
You broke up just a little bit. Yeah. Well, it's going to take all of us working together to make this happen. I've said from the very beginning, whatever plans we have in place, and we have probably the most comprehensive plan of any state in America, by the way, and now broken down into how we open up our school system. If we don't all participate and correctly, it won't work. It will fail. That means that parents have got to teach their young people when they go to school that they should wear a mask and encourage them to wear it. Certainly cultures around the world, we have young people from kindergarten on up that are wearing masks as just part of their culture. Our studies have shown that there's nothing harmful about wearing a mask. It would be very rare if somebody has a rash or something that occurs, but wearing a mask is safe, and it helps protect you from receiving droplets from somebody else, and more importantly, maybe helps from you from spreading droplets yourself. And unfortunately, what we're finding is that we have a viral load that peaks just before you have symptoms. So you may feel fine, but you may still be able to spread the virus, but you won't if you're wearing a mask. So again, it's a matter of people. There's no excuse for people riding the bus, going to school, and not wearing the mask. That's part of the requirement. And we hope teachers and principals and parents will work together to make sure that that's in fact the environment that we find ourselves in. If we, in fact, we don't do that, and we have a surge of infections, then in classrooms schooling will cease to be. We'll have to close that down. That's certainly a possibility. But that has its own downside as people don't go to school, don't get a good education. In-class education seems to be the most profitable, most effective way for people to learn. That doesn't mean we can't learn online and do distance learning and certainly homeschooling. But for most people, going to school in a typical fashion and have a teacher face-to-face is the best way to learn. So we need to do all that we can to make sure that these plans of these 41 school districts work and that our school system does, in fact, operate.
Hi, Governor. Ben Winslow with Fox 13. This is a question for either you or Deputy Director Checketts. Since we are seeing a decline in people seeking out testing and we still have the capacity of almost 9,000 a day, as you say, why not expand it to maybe people who are asymptomatic or who don't necessarily display some of these other symptoms, no matter how mild, just to see if you truly have a decline or if there's greater spread?
Very good. Nate, you want to come in? Doctor, have you anything you'd like to say about that?
Yeah, it's a great question. One of the things that we've been doing is through the Department of Health, we have mobile test teams that are out, and they are able to do collections at nursing facilities, at community sites in an outbreak response. And so as we've seen over the last couple of weeks that the numbers are coming down, we've given them a broader green light to go out and do more testing, set up additional events. We have 4 events set up over the next 8 days or so, where we're doing testing in West Valley and other locations in the western part of Salt Lake County that we've amplified in response to the fact that we have more capacity both on our collection side and also on the lab side. So we're ramping up those activities and also authorizing more of those to move forward. We're also looking forward to the future and to see what's coming next around the corner. We have back to school that we're talking about and whether or not that's going to impact the number of tests coming in. And then we have the flu season coming too. And so as we think about whether we should expand the definitions of who should get tested, we're also looking at that horizon, and we don't want to be, we've noticed over the time that it's been difficult for us and the public to stay on the same page on what the testing guidelines are and where we're at. And so we're also wanting to be cautious that we don't say everybody can get tested and then have to come back a week or two later if there's another surge to say, okay, now just symptomatic individuals again. So we're trying to balance moving forward and expanding, but also a consistent message that stays, that people can rely on over time.
Thank you, Deputy Director Checketts. I agree with what you said. What I would just add is that for every test, there's the right time, the right place, the right patient to get a test. And so it's important that we continue to learn and apply the science and apply the evolving body of knowledge around how best to use our tests. I think preserving that capacity for what might come this winter during the flu season is really important as well. And I'm just grateful for the guidance from the Utah Department of Health, from the Centers for Disease Control that help us in this area. So right time, right patient, right place, right test. Let's approach it in that way.
Next question.
Hi, yes, this is Jacob Kloffenstein with KSL. I think this question is going to be for Mr. Checketts as well. Kind of going along with Ben's question, if we're still seeing these lower numbers of tests, is there a chance that there might be, kind of random testing out in the community or spot checks or that sort of thing? And then you mentioned earlier that, health officials rely on testing results to assess how the disease is spreading and where it's at. What is the benchmark for tests per day to accurately get a picture of that? I've heard 7,000 per day is kind of a number thrown around that's, inaccurate, gives health officials a chance to accurately assess the spread. So what's that benchmark?
Yeah, so let me address the benchmark question first. There's a variety of different numbers that are out there. Some come from Harvard, some from other areas. Some of them talk about a number of tests per 100,000 individuals, like 75 tests per 100,000 individuals. So most of the ones that I'm familiar with, as you mentioned, may go up to 7,000. I've seen them from 2,000 to about 7,000 that they would recommend that a state be doing on a regular basis to have a good feel and a good pulse on what's going on in its community. And I forgot your first question. Could you ask that one again?
Yeah, if we're still seeing lower testing numbers, is there a chance that we might see random testing out in the community or spot checks or that sort of thing?
Oh, sure. Yeah. So the state has been doing a random process through a project that it calls Project Hero. It combines an antibody test, and they're also doing the PCR test too. And they have been doing this work over the last couple of months in different communities to give us a sense of what's going on out there. They continue to do their work, and they're moving into phase 2. They're looking to do some heavier testing in schools to help us get a better feel in that area. So that project is continuing and will continue to add to our understanding of what's going on with the virus. And then, as I've mentioned, we're looking at opening additional collection sites and using our mobile teams to a greater extent to be able to collect more tests in this period where there's a lower demand.
We'll take 2 more questions.
Yeah, hi there. This is John Reed from KUER. This is probably also a question for Mr. Checketts. It's kind of a 2-part question, but I'm curious, you mentioned antigen testing. I'm curious, is that being done in the state right now? And where is it being done? And then I have a follow-up after that.
Yeah, and thank you for breaking that into 2 parts. On the antigen testing, yes, there are antigen machines that are in the state, most likely in some of the providers' offices or in outpatient clinics. These types of tests are actually the machines, and this antigen testing is actually something that's widely available for other purposes, for flu and strep and other reasons. And so these machines are often already in some of these facilities. They're with Abbott machines or Quidel, BD. These are some of the manufacturers of these machines. What's new for the COVID response is that they're coming out with a test that can be used with these machines that specifically detects the COVID-19 virus. And so that's where some of the bottleneck has been with these, is getting those tests out and available to providers and to us. As mentioned earlier, the state is heavily engaged right now in making purchases of these machines to make them more available. It's not the antigen test, which is your specific question, but it is another rapid test with the Abbott test We received 15 of those machines earlier in the year. We deployed them to tribal facilities, to frontier hospitals, to correctional facilities so that they would have advantage of these 15-minute type turnaround tests. And our plan is we're working with local health departments right now to develop a list of over 100 sites where if we are able to get more of these antigen tests or these rapid tests, that we would put them out in additional facilities like this, like jails and other areas, homeless resource centers, so that where we think that having that rapid test would be most important to the response. In addition, the federal government is rolling out a massive program across the country where they are sending antigen tests to nursing facilities. And our facilities in our state have already started to receive those. And I believe the goal of the federal government is that every nursing facility will have an antigen test on site once they complete that process. And you had a second question?
Yeah, and then, I mean, you've sort of touched on it a little bit, but there seems to be sort of a debate going on right now among health experts about whether the U.S. should kind of shift its focus on testing to use more of these antigen tests, which are, they say, are less accurate, but just the fact that they're a little bit cheaper and quicker, that would allow more testing and people to get tested more regularly, repeatedly. And that would be especially helpful, you know, as schools reopen and we're trying to get businesses open. And so I'm just curious, you know, what is either yours or maybe the Department of Health's kind of position on that debate?
Yeah, antigen testing right now is moving in that direction. It's headed in the right way. It's not quite there yet to do everything that you just said. One issue is the cost. Costs are definitely lower on the antigen test than they are on the PCR test. But they're still in the $20 to $30 range per test. And while that's helpful, that's better than what we're seeing in the PCR. That's not down into the range where some people, you know, there's been op-ed pieces and others that say, if we had $1 test, how would we behave? We're not there. That's not where these tests are right now. And also the other issue that we're running into with them is that the manufacturers, although they're ramping up significantly, the demand is still much higher than the availability. So as we look at the antigen test and we look at the work that the federal government is doing, we're hearing that as they're doing this nursing home project, that they're actually taking up a lot of the production capacity right now. And so we're going to have to, the manufacturers are going to have to overcome that in order for the rest of the population to get more of those tests.
Okay, the last question.
Yes, Governor Herbert, when you're talking about opening the schools, a lot of this has been presented as sort of a rosy outlook that we're going to open the schools and we're going to, you know, more social distancing and there will be masks. But I'm wondering if you're doing any game planning for a worst case scenario. Are you talking about what it might look like if things go wrong and you have to close things down again? And can you give us a sense of what those discussions are like?
Well, Brian, I'll just say what I've said all along. There's no way to absolutely have zero risk. So there is a risk involved. We've tried to mitigate that and minimize the risk. All the plans, though, have, in fact, a plan B to it. If, in fact, we have infections that rise to unacceptable levels, then how do you quarantine the class? How do you quarantine the school? And, in fact, you drop back to all distance learning online, as we did at the end of the school year earlier in the spring here. So all the plans have, in fact, a plan B to it in case it doesn't work. But it's like anything else. You don't know until you try. And I think it's important we try. As the pediatricians have told us, you know, we need to start with the goal of taking kids back into the classroom, into the brick and mortar buildings themselves to meet their teachers and their classmates. And then if it doesn't work, then we'll go back to some other alternative. But that's, all 41 districts have those plans in place. With that, we thank you all. Let me just sum up. I appreciate Dr. Mark being here to tell us, you know, hospital capacity is there. Do not delay any health care needs because you're afraid to go to the hospital because of COVID-19. That's a false fear. They're doing all they can to make sure that you have an opportunity to get your health care needs at the hospitals, the medical clinical buildings that we have available out there. So don't delay getting health care as you need it. Nate Checketts has helped us understand a little bit better about the testing programs that we have available. Like this entire pandemic has been an evolution. It's a learn as you go. There's certainly been a significant evolution in testing. From the very beginning of this pandemic, testing has been a big issue for us as the state of Utah and for all the states around the country. And we've done pretty well in Utah. We've, in fact, we're at the leader in the beginning of this on testing. We've slumped a little bit in the middle, but we're back on top again now as we provide opportunities for people to be tested. The testing process itself is evolving. We would like to have everybody get tested. Obviously, we can't do everybody, but we certainly can do everybody that's got symptoms. And we've encouraged people, if you have symptoms, it's not hard to get a test. And basically, it's no cost for most everybody in the state. So don't let costs keep you away. If you have a sore throat, get tested. If any of the symptoms, get tested. The testing program we've had in place has been self-selecting, still somewhat that. If you feel like you have a symptom, I'm going to get tested. If you don't feel like you have a symptom, you're not going to get tested. So that group that we have self-select clearly are those who are more likely to have the COVID-19 virus as opposed to others who don't have a symptom. So again, the numbers are dropping down. The percentages are staying basically the same, which is probably understandable. But we want to encourage people to get tested. And the idea that maybe we'll start doing more random testing, have people be able to come in and that don't have symptoms, is one we'll look into. Again, making sure we still have capacity if we have a surge. So there's got to be, again, a plan B in case something goes awry. But again, thanks to everybody here in the state, all stakeholders, our school people, our school board members, citizens, our business community, our healthcare professionals. Really, we're working together in a very significant way that's helping us have a positive outcome. But now's not the time to let up. Now is the time to redouble our efforts to make sure we do what we can do as we go into the fall season. And again, we start going more indoors, which I think is a little more risky than being outdoors. And that's just the nuances of coming into fall and winter. So let's redouble our efforts, let's work together, and we'll conquer this pandemic. Thank you very much.